Okay, it's Tuesday at 5:30. Let's get started on our live Q&A. I am Dr. Correa, board certified plastic surgeon at your service, here to answer any and all questions plastic surgery related. So let's get started. We got a bunch of questions this week. What are non-surgical options for a double chin? I've heard about Kybella. Can it be used on my nose as well? So for a double chin or extra, what we call submental fat is kind of the medical term for that. You can kind of see a nice example on me. I need to lose a couple of pounds here. But anyway, if you've lost your weight and you've still got this, I have not lost my weight yet. But if you haven't and it's stubborn and it's there, Kybella is a great option to treat that. Typically it depends on how severe it is. The average patient, usually it's 4 vials, 2 vials of the first treatment, and then 2 subsequent treatments, each with 1 vial. And that does a pretty good correction. If you're on the younger or more mild side, you might get away with only 2 vials or maybe 3 vials. If you're on the older end or you have a fuller neck, it might take more than four vials. But ultimately, that's, if you think it might be for you, come in, set up a consult. We'll do an evaluation and see if it makes sense or not. As far as the nose goes, probably a miscommunication somewhere. Kybella is very much just a fat dissolving product. So in the nose, there are some filler options like hyaluronic acids, Restylane, Juvederm, things like that. Those are still off-label, but they can be, safely done as long as it's done judiciously and with good judgment and conservatively and appropriately. But Kybella generally is not used on the nose because, again, it's very much a fat-specific treatment. People have experimented with using it for body contouring. It does dissolve fat, so why limit it to the face? You'd think it can dissolve fat anywhere else in the body. I think it holds some promise, but one of the challenges with getting these facial treatments applied to the body, to be totally blunt, is that they are manufactured and priced for the face. So using a $700 vial of Kybella on the neck makes sense. Using a $700 vial of Kybella on a belly that requires a larger area, we're going through a ton of vials at that point. And so it's challenging to get the pricing to make sense. Same thing with Sculptra. There's been a lot of social media traction gained with using Sculptra for like hip dips and buttock augmentation and BBLs without using fat. And it seems to work, but the problem is you're using so many vials that it's cost prohibitive. I think in the most famous example, I think the person had injected 70 vials, that's 70 vials of Sculptra. For perspective, an average price for Sculptra for the face, which is what it's designed for, 1 vial is about $700 to $1,000. So you do the math, that's like 50 grand for like a 2-year result. So we'll see if they maybe reformulate that for body applications because, I don't have too many people banging down my door trying to give me 50 grand for a 1.5-year result for their buttock. Doors open, come on in, we've got it. But we'll see what happens with that. So, all right, jawline definition. I want better a more defined jawline. I don't like my jowls. If we're jowling, that means we're on the slightly older side of things. There is a discussion to be had for younger folks that desire more aggressive jawline definition. If we're talking about jowling, then that puts us in a slightly older category, and it's more of a facial aging discussion in terms of getting that jawline to transmit more. A jowl is basically what we call the tissue. Thankfully, I don't have one of these yet, but I'm sure I will soon enough. Kind of in between here and here where it kind of bulges and falls down like that. When it gets really severe, it kind of gives older men that kind of puppy dog type look where it looks kind of droopy. So that's what a jowl is. Fillers can work, and it's more of a camouflage technique where you basically fill in front, fill behind, and that kind of smooths that transition to just give a more camouflaged result and bring out, the jawline that you can't see as well. It doesn't actually correct the jowl. But that's kind of the best you can do non-surgically. If you really want your jowl fixed and you want a beautiful jawline, really the ticket is doing a nice facelift, which includes a neck lift. A facelift is very much a jawline operation. People don't think of it that way. It's it's not that intuitive, but it's very much a jawline operation. Even a neck lift, very limited in its ability to actually define your jawline without doing that facelift component. And there's some surgical reasons for that. But just for sake of our live Q&A, just take my word for it that if you really want a beautiful jawline definition, correction of your jowls, and you're on that older category where we're talking about, a lot of facial rejuvenation, then a full facelift, including a neck, is going to be the ticket to kind of really define that. If you're in that younger category, it really depends, unfortunately. It depends on if you have any weight to lose. It depends on what your skeletal structure is. It depends on what your definition is and what you're thinking of in terms of jawline definition. Some things can be enhanced, with some filler product. It very much depends. In a young, healthy person of a normal weight who wants more jaw definition, very case by case. Hard to make generalizations about that. What is Sculptra? Sculptra is a longer acting filler. It's one of the longest lasting products. It's an excellent product. Probably lasts 2 years, 18 months to 2 years, if not more. The question of how long something lasts is a little bit nebulous, because really what people mean when they ask that is how long does the result last? And so, scientifically speaking, if we take a biopsy, we'll probably still detect Sculptra at 2 years, 3 years, 4 years, 5 years. But can you still see the impact of the product on your face? Whatever you were trying to treat, is the treatment effect still there? And that's where the variability comes in. Same thing with fillers anywhere else on the body, lips, nose, cheeks, anywhere. How long does it last? Really, the question is how long do I maintain my effect for? And so with a lot of products, what we do is if you're a first-time person getting treated, we treat till we get the desired result. We have in our medical record how much we used and where we put it. And then we kind of know, we've got our photographs to know what we're kind of going for. And then ultimately people kind of land on their own schedule where it's like, I know for me, I'm treating my lower eyelids. I know I need to come in once every 6 months for a small touch-up. It's not a big touch-up like the first time. It's maybe half a syringe or less, just to maintain that result that I like. After 6 months, I start being able to see the shadows and I don't like it anymore. Other patients, it might be, I get my lower eyelids treated. It takes 9-12 months before I really see that shadow pop up again. I come back and get retreated. So, sorry, that was a huge digression. So Sculptra, so excellent product. It does last a long time. And in the filler world, the injectable world, the non-surgical world, lasting a long time sounds like a desirable thing, but it's got its downsides. So it's excellent if you love your result. It's a horrible thing if you hate your result. So with those products that are longer lasting, you just have to be very careful, judicious, accurate with your delivery of the treatment. And in patients who... in many patients, often I will suggest using a more temporary filler to kind of try it out, make sure you're happy with it before we convert to something that's a little bit more permanent. The Sculptra is a little bit more expensive as well. So the only thing worse than having a permanent result you don't like is a permanent result you don't like that you paid a lot of money for. So sometimes we'll kind of hedge our bet, so to speak, do a more temporary product, make sure we're happy with the result. Again, we've got photographs, we know what we're shooting for, and then we can tackle it with Sculptra to get that longer lasting result and have a greater degree of confidence that we're spending our money well and going to get the result we want. How long does fat last in the face? So fat injections, fat grafting in general is permanent. They are viable tissue, viable cells. Once they are injected, whatever survives is there forever. It's a live cell, and it's you. So it just gets transplanted into wherever you inject it. We never get 100% take. In areas like breast reconstruction, maybe we get 50 to 60% take. And someplace like the Brazilian butt lift, you probably get more like 75% take. When you get into the face, it's a much more highly vascularized area, and we're able to inject in a way that increases the viability. And so we tend to get more like 90% take in the face. But yeah, once it takes, it's 100. Once it takes, it's going to last forever. Again, the same conversation applies as with Sculptra. So if it lasts forever, well, let me do that. Why am I injecting Restylane every 6 months when I could just inject fat and be done with it? Number one, you can't inject fat everywhere. So for example, lips are a very common example where people just beg you to inject fat because they love their lips, they want it to last forever, and it's just has never worked out favorably in the past. It's something that is extremely problematic when injected into the lips. Places where you can inject it, where you get a very nice result: nasolabial folds, cheeks, very good areas; temples, very good areas. Those are probably the most common areas. Eyelids, another very terrible idea, very, very bad place to inject fat. And it's not that in a perfect world, you could inject the lower eyelids, but the reality of trying to inject fat in that area is that you get kind of a spotty take. And so if you end up with fullness over here and an empty spot over here, it's effectively impossible to try and correct that. And then you're having to still inject filler to try and camouflage the lumpy, bumpy nature of the eyelid injection from the fat, and then that fat is in there permanently forever. Can't really remove it. It's a problem. So anyway, fat does last forever, and again, it's in that category. Use it judiciously. Maybe try out some filler first in the areas that you like. Make sure you're happy with it. That being said, in the right candidate, you can have absolutely magnificent results with facial rejuvenation and like facelifts, for example. Combining fat grafting with a facelift, for example, very powerful tool. Greatly improves the result. Almost every facelift patient, I shouldn't say that, but many facelift patients will benefit from having some extra volume and volumizing that face. And so in a lot of patients, I end up recommending that, where we do just a tiny little bit of liposuction, because it doesn't take a ton of fat. Tiny bit of liposuction, inject that judiciously into most commonly the cheek area, nasolabial folds, and it just really enhances the facelift result. I'll donate some fat for some. If I had a dime for everybody who wanted to donate fat to somebody, that's the next frontier. If I figure out how to do that, we're going places. Okay, will filler work for my under eye bags, or do I need surgery? Another question of degree, as with all of these filler questions and non-surgical options. It's a general truism that the more mild the problem we're trying to treat, the more likely you're able to get away with a non-surgical solution. With filler, we're very much limited. It's very much a camouflage technique. What do I mean by that? I guess I use that a lot and I haven't really explained it. Camouflaging is when you're delivering a treatment to try and hide or mask something that we don't like, but it doesn't actually fix the problem. A good example of that is, non-surgical, filler for the nose, where if you've got a bump on the bridge of your nose, you fill in up top and it camouflages the appearance of that hump because you don't have that dip going into a hump down there. And so it camouflages it, but it doesn't really actually treat the hump. The real fix for that is to do a hump reduction, do surgery and reduce that. And that's the true correction. And that's what we call treatment. It's no longer camouflaging, now you're fixing it. And so using filler in the lower eyelids and almost anywhere, now that I think about it, is very much a camouflage technique and a patch to cover up something or compensate for something that doesn't actually treat the underlying problem, but hopefully, mitigates it to a point where we're satisfied with it and can avoid surgery. For the under eye area, generally we're talking about treating the tear trough area. The tear trough is basically where your regular cheek skin, if you look carefully in the mirror, you'll be able to see normal cheek skin, which is a little bit thicker, a little bit more ruddy or sebaceous, and then the eyelid skin, which is that extremely delicate, very fine, very thin skin that has effectively no subcutaneous fat in it. That junction is what we call the tear trough, and it's right where the bone is underneath your eye area. And so you fill that area with some hyaluronic acid, and it camouflages that transition and fills it up. Something you can't really treat or are limited in your ability to treat with a filler approach is going to be an eyelid bag. So that's where you actually have fullness of the eyelid above it, and you get. I think everybody knows what I'm talking about. It's hard to put in words, and the terminology is actually confusing in the plastic surgery literature. Some people call them malar bags, some people call them lower eyelid bags, some people call them festoons. Not all of those are accurate. But the point is, if you have a big old bag of fat under your eyelid, it's very difficult to effectively treat that with filler. And then it becomes a question of degree. A lot of people also confuse or conflate fine wrinkles and fine lines of the lower eyelid being able to be treated with a filler, and fine lines aren't even technically corrected with a lower blepharoplasty. You do excise some skin with a lower blepharoplasty, so it can kind of iron them out or distribute them a little better, and so make them improve a little bit. But with time, as the tissue relaxes, those fine lines tend to come back, and really the treatment for fine lines is more of a skin treatment, like doing a resurfacing treatment, doing skincare, things like that. So as far as fixing under eye bags, it won't truly fix the under eye bags because it's just a camouflage technique. In mild cases, we can fill strategically below that bag to try and camouflage it so that, again, it doesn't catch as many shadows when we're taking pictures, looking at ourselves in the mirror, whatever it is. It's just the light gets scattered a little better so that you don't see all the convexities and concavities that lead to those shadows that make a bag what it is. So next up, where are we at? 5:46. All right, we'll wrap up. Ooh, this could be a long one. You know how I love belly buttons. How do I avoid the belly button surgery with tummy tuck? I like my belly button. That's a bit of a can of corn. The 5:46 p.m. version that we're closing up shortly is that if you're a candidate, almost running out of battery, if you're a candidate for a mini tummy tuck or some sort of mini tummy tuck approach, whether it's extended, any mini tummy tuck approach, and there are a number of them, we do preserve the belly button. And so there's no scar around the belly button, there's no incision around the belly button. Your external skin belly button, whatever your average human being thinks of as their belly button, does not get a surgical scar around that. Many patients who can still do a mini tummy tuck often could benefit from some improvement to the shape of their belly button. As we age or get a little bit overweight, sometimes the belly button, instead of having a nice kind of oval, mostly vertically oriented appearance, it can kind of flip and become more transverse, or you kind of get that frowny face or upside down smile above the belly button where it kind of hangs over, and so you get this kind of transverse line. And so even with a mini tummy tuck, we can often improve that, and patients like that improvement. In terms of the shape of the belly button, it kind of goes back to normal, or if you just hold your belly skin and lift up, and you can see your natural belly button kind of reappear, so to speak. You can get that result with a mini tummy tuck. But the point is, to really avoid that external scar, you have to be a candidate for mini tummy tuck. Put another way, if you need a full tummy tuck to get a nice result, the belly button becomes, in that situation, what we call a trade-off. A trade-off is basically something we don't necessarily want, but it's a cost for something that we really do want. And so that's the world I live in, especially in cosmetic surgery, is what are we trying to gain? It comes at a cost. Is that equation acceptable? And so that's where that discussion lies. The belly button is a good place to look if you're hunting through surgeons, hunting through galleries, and trying to pick out who to go see. There are some terrible belly buttons out there, and there's some people who just do it terribly routinely. That's just the way they do it. As far as I'm concerned, it's just laziness. It's not, I do think I'm good at what I do, but I don't think that you need to be like some surgical savant to be able to get a beautiful belly button result. It just takes a little bit of extra effort to make it look nice and a little bit of attention to detail. So anyway, look at the belly button. It's at least a sign of attention to detail. And if you've got that target, circle around a belly button result, caution recommended. All right, I've gone over. I am on detention and in trouble. Need to sign off before the teacher catches me. Have a wonderful week. Hope you had fun. It's Tuesday. This is the best day of the week, not counting Wednesday through Monday. With that, I leave you till next week.